So what truly makes a country healthy? Is it just, the economy? Or is it something maybe more fundamental, like how its youngest, most vulnerable citizens fare in those first few years?
That's a great question. And today we're really diving into that second part specifically, under 5 mortality. It's a critical health indicator.
Right. And globally, the picture looks, well, better. The rate, U5MR, dropped massively from 94 deaths per 1,000 live births back in 1990 to about 37 in 2023.
Huge progress, absolutely. But there's a stark contrast when you look closer. Southern Asia, for instance, shoulders a massive 26% of the world's entire under 5 mortality burden.
36%. Wow. So that brings us to India specifically.
Exactly. India's seen improvement too, thankfully. U5MR went from 109 back in the early 90s down to around 41.9 more recently.
That's still a big drop.
It is. But the national average hides significant variations. Certain regions, what we call Low Sociodemographic Index or LSDI states, think Uttar Pradesh, Bihar.
Okay, areas maybe with lower education, income, that sort of thing.
Precisely. In those states, the rates are still hovering around 45 deaths per 1,000 births, still higher than the national average. So they're really critical areas to focus on.
That really underlines the need for targeted action, doesn't it? And I understand there's a new study just out that takes a really different approach.
Yes, absolutely. That's our mission for this deep dive, to unpack this June 2025 study. It uses cutting-edge machine learning.
Machine learning for predicting child mortality.
Exactly. To predict U5MR and, maybe more importantly, to really pinpoint the key factors driving it in these specific vulnerable states. Think of this as a shortcut for you to grasp these complex health challenges and some pretty innovative solutions.
Okay, I'm intrigued. So the study's approach analyzing data from India's National Family Health Survey, right?
Yeah.
Over 94,000 children. That's
right, NFHS5 data. And what makes it unique is that it applies survival machine learning models. It's the first time this has been done in quite this context.
Survival machine learning. How is that different from, say, standard statistics? Why is that a step up?
Well, it's a bit of a game changer. These models can capture really complex nonlinear relationships between different factors, things that, older statistical methods might completely miss. It gives a much sharper, more precise picture of risk.
Okay. And what did this sharper picture reveal? Were the findings stark?
They were sobering, definitely. Among the children studied, 4.5%, that's over 4,200 children, sadly died before they reached their 5th birthday.
4,200. That's tough to hear. What were the biggest risk factors the models identified?
The models quantified the risks very precisely. For example, children born to younger mothers, say 15 to 25, had about an 11% higher risk. The hazard ratio was 1.113.
Okay, 11% higher. What else?
Education or lack thereof was significant. Children whose mothers had no education faced a 26% higher risk. Poverty was huge. Kids from the poorest households, they had the highest risk, a 72% increased likelihood of death. Hazard ratio of 1.719.
72%. That's massive. And birth weight, I imagine that plays a role.
A huge role. Low birth weight children faced basically double the risk, a hazard ratio of 2.091.
Double the risk. Wow. Okay, those are all maybe factors we'd expect to some degree. But I heard the study found something even more surprising, something with an even bigger impact.
You heard right. This one was really eye-opening. It's about what happens right after birth. Children who were not immediately placed on their mother's chest.
Just simple skin-to-skin contact.
Exactly. Those children had a staggering 2.2 times higher risk of death, a hazard ratio of 2.221. That's 122% increased risk.
Over double the risk just from not having that immediate contact.
Yes. It just powerfully underscores how vital that early bonding skin-to-skin and initiating breastfeeding really is. It's a relatively simple, low-cost thing with a potentially monumental impact.
That's incredible. Such a seemingly small action.
It is. And yes, other factors like being male or belonging to certain castes also showed up. But the magnitude of those top factors, poverty, education, birth weight, and especially that immediate contact, really stood out.
So these machine learning models, particularly the survival ones, were key to uncovering this. Did one model perform best?
Yes. The study found that the random survival forest, or RSF model, was the most effective, especially for predicting outcomes in the shorter term, like within the first 20 months of life.
Random survival forest. And being effective in those first 20 months, that's crucial, right? That's when intervention can really count.
Absolutely. That precision means you can identify the highest risk children early and potentially intervene when it matters most. Connecting this back to the bigger picture, the study really highlights the need to, well, empower women through education, improve family planning, seriously tackle poverty, and ensure healthcare access is equitable.
Because the disparities are still there, even with the overall progress.
Very much so. In these LSDI states, 130 out of 248 districts are still above the national U5MR average, and only 32 districts have actually met the UN's Sustainable Development Goal target, which is 25 deaths per 1,000 births. Still a long way to go in many places.
So pulling this all together, what does this study really mean for how we approach public health, especially for kids?
It's a powerful reminder, I think. Progress is happening, yes, but these kinds of innovative data analyses, like using machine learning, can show us exactly where we need to focus our limited resources. We move beyond broad strokes to really targeted, data-driven actions.
It gives us a much sharper tool, which leads to maybe the final question for you, the listener. As we get better at using advanced tech like ML to find these insights, how do we make absolutely sure they don't just, sit in academic journals? How do we translate this knowledge into real, life-saving changes on the ground for the world's most vulnerable children?